Hello, my name is Shannon Bordis. I would like to welcome you on behalf of our team, including Kapala Garwal, Simi Matthew, Alexa Hanny, Dana Lamont, Saber Taj, and Danish Sami. We hope you find our presentation on the beverage healthcare model informative. We begin with an overview of the beverage model, including its origins, basic features, history of adoption, implementation, and evolution. The beverage health system model originated in the United Kingdom, a sovereign nation comprised of England, North Ireland, Scotland, and Wales. The beverage model has been adopted in Spain, Scandinavia, New Zealand, Cuba, and Hong Kong. The model was named for Sir William Beveridge, a social reformer who was instrumental in designing the British National Health Service, or NHS. In 1942, Beveridge prepared the Social Insurance and Allied Services Report to garner support for a national health system. The NHS was established by the National Health Service Act in 1946 and became effective on July 5, 1948, making it the first Western health system to provide free coverage for the entire population. Guiding principles for the foundation of the Beveridge model include universal access to high-quality healthcare for all, services that are free at the point of delivery, social and geographical equity, and services based on clinical need rather than ability to pay. In the aftermath of World War II, Great Britain was faced with the challenge of rebuilding a nation devastated by war. In pursuit of a national health service, Beveridge appealed to post-war sentiments of the British population, insisting that the purpose of victory is to live in a better world than the old one. Britons agreed and were hopeful the new system would provide a better quality of life for all. The Beveridge model is a single-payer, single-provider model. In the UK, the NHS is funded through taxation, and the government is directly responsible for providing reimbursement. The government owns and operates most of the healthcare facilities and employs most of the healthcare personnel, making the NHS the largest employer in the United Kingdom and a top 5 employer worldwide. Private practice medicine does exist, but is only utilized by a small portion of the population. The NHS is comprised of physicians, nurses, pharmacists, dentists, and opticians. General practitioners, or GPs, typically serve as the primary point of patient contact. They control referral to secondary providers, such as specialty physicians and surgeons. Community-based services and ambulance trusts are also included in the NHS. Additionally, funding for healthcare education is supported through NHS bursaries, promoting the healthcare provider workforce. The NHS has evolved throughout the 75 years since its inception, from changes shortly after adoption to allow fees for prescriptions, to including mental health care within the NHS administration. The Organization of Healthcare Authority has been restructured many times as well, including regional to district management in 1982, primary care trust formation in 2002, eventual abolishment of strategic healthcare authorities and primary care trust in 2011, and most recently, restructuring for integrated care systems in 2022. Publishing of the NHS Constitution in 2009 marks a significant timeline event, as this document established rights and responsibilities for patients and staff. I now turn you over to Danish for an in-depth look at the United Kingdom.
Thank you, Shannon. Now I'm going to be talking about some basic country information. United Kingdom is a state made up of historic countries of England, Wales, and Scotland, as well as Northern Ireland. It is known as the home of both modern parliamentary democracy and the Industrial Revolution. It is the 6th largest national economy in the world with a GDP of $3.19 trillion, with a population of 67.7 million and the life expectancy of 79 years in men and 83 years in women. If you look at the total healthcare expenditure as a share of GDP in the United Kingdom from 1980 to 2021, you can see that in 1980 the figure was 5.1, and gradually over the period of 20 years it has improved, going up to 7.9, and then in the next 20 years it went up to 9.9. And in the last few years, it has jumped to 12% and 11.9%. So we can clearly see that the government is expecting spending more money on generally as share of their GDP. Now, the healthcare expenditure as percentage of GDP as compared to the other countries in 2021, the United Kingdom stands at 11.9%, but when we compare it to the US expenditure, it's 17.8%. However, if you look at Germany, France, Austria, Switzerland, Canada, and Sweden, it's more or less the same figures, around about 11 to to 12% figure, which is in comparison to other European or Western countries. Let's have a look at the pest analysis. The UK National Health Service is the main provider of health services working under the Department of Health. The political decisions drive the policy making and allocation of resources, and the different political governments play an important role in setting priorities for the healthcare industry. With economy-wise, with the rising demand and increasing cost of the healthcare played an important role as the UK increased the GDP spent on healthcare sectors, and funding for different sectors again is a highly political issue. Socially, NHS is considered one of the best social welfare systems in the world. With an aging population and changing demographics, the system faces significant challenges in delivery of quality of care. Electronic medical records and telemedicine has been the main area of focus in the last few years, especially with the COVID. The challenge remains as the hospitals are not connected to a cloud system, and there is fragmentation and duplication of services. And in the end, I'm going to be talking about the burden of the disease. Cancers, cardiovascular disease form the main bulk of the burden of the disease in the United Kingdom. Neurological disorder, respiratory diseases, diabetes, and kidney disorders are the less of the evil. Now I'm going to hand over to Simi, who's going to be talking about the health system structure in the UK.
NHS falls under the Department of Health and Social Care and is run by NHS England, of which the board is a senior decision-making body. NHS England has regional teams across 7 regions who are responsible for the quality, financial, and organizational performance of all the NHS organizations within that region. They also have integrated care systems, which include integrated care partnerships that are formed between NHS and the local authorities to meet the health and well-being needs of that area. Under ICSs are also the ICB, or the Integrated Care Board, which is a statutory NHS organization responsible for meeting the health needs of the population and managing the budget and needs health services of the ICS area. On the right here, we have a map of the 42 different ICSs established within the UK. The NHS released their long-term plan, which is their policy framework that outlines their health priorities over the next 10 years. This includes increasing support for outpatient care to reduce pressure on emergency services, provide patients more control over their health, and focus on population health at local levels, prioritizing preventative care and health inequalities to reduce smoking, obesity, to prevent diabetes, and increase support for learning disabilities, to improve quality of care outcomes by increasing early detection of cancer, increase faster access to community crisis mental health services, and improve care for chronic conditions, increase support for their staff, and increase access to digitally enabled care by upgrading technology across the NHS over the next 10 years. The long-term plan also outlines how these priorities align with social justice. For example, as part of the plan, the NHS will be increasing their investment for mental health crises provided across detained settings such as prisons, courts, and immigration facilities, improving regular access to health care for those in the justice system, expanding their investment in community service requirements rather than custodial sentences for offenders with mental health concerns, investing in trauma-informed services for youth justice system, and improving their support to the justice system to provide healthcare support to victims of sexual assault. The NHS provides coverage to all legal residents of the UK. However, voluntary private coverage is available to those who are interested. About 10.5% of the UK have adopted private coverage in addition to what's covered through the NHS. Private coverage varies by provider and plan and generally will provide faster access to care and covers specialized services such as a consultation with a specialist. Excluded care includes emergency care, maternity care, and chronic conditions. Through the NHS coverage, residents have access to a number of services, which include primary care, hospital visits, urgent and emergency care services, preventative care such as screening and immunizations, maternity care, and sexual health services. Areas with more limited coverage include clinically necessary dental care and optical care, and long-term care. Notable gaps in coverage include routine dental care, routine eye care, which includes the coverage of glasses or contact lenses, and outpatient prescriptions. While prescriptions in the inpatient setting are typically covered, and they do provide exceptions for groups such as the elderly or children in the outpatient setting, generally outpatient prescriptions are not covered through the NHS. In 2020, the 60% of the healthcare expenditure fell to curative and rehab care, which consists of inpatient and outpatient care, day care, which includes care that does not include an overnight stay, and home-based care. This accounted for 134 billion pounds in 2020. On the right, we have the expenditure by function and type of financing. So as you can see, out-of-pocket was highest for pharmaceuticals and long-term care at around 5% each. And the highest spend for the general government was for inpatient and outpatient care, which aligns with the graph on the left from 2020. Thank you, and I will now pass it on to Gopal.
Thank you so much. Now I'm going to talk about the healthcare performance. The government healthcare expenditure is estimated to be increased by 7.5% in 2021. It is likely to be driven by the COVID pandemic. The GDP from 2019 to 2021 has increased from 10 to 11.9%. In most recent periods, the labor forces have shown decrease in vacancy rates versus there is increase in unemployment rates in the country. Here we see the comparison with other countries. The UK is definitely spending towards the higher side, but it also provides the quality of service. What are the cost reduction strategies? What are the priorities? Urgent action is needed on workforce shortages. Secondly, there is record high hospital waiting list in England could grow to somewhere between 7 to 11 million by 2023. The government has committed to leveling up the country, but so far has not matched this ambition. Changes make the policy less fair and generous to the people with lower wealth. What have they done? Better Care Fund framework was launched in 2015 to join NHS. They aim to enable those who needed to get the right care in the right place at the right time. Spending is broken between revenue funding and the capital funding. The government provided significant emergency funds to the DHSC to support the response to COVID-19. What are the quality measures? How can we improve them? The quality in the context of healthcare is multidimensional framework that captures 6 domains: effectiveness, efficiency, equity, safety, timeliness, and patient-centeredness, enabling to deliver precision data, faster time to value, and better flexibility compared to clinical data integration. It solves the provider's problem. Thank you.
Thank you, Gopal, for your review of the National Health System's performance. My name is Dana. Let's review some of the information on access. As we mentioned, the National Health Service is established with the goal for universal access to high quality care. Anyone residing legally in the UK gets free health care. You don't have to be a British citizen or employed. If you are a European health insurance holder, you also have access. 100% of the legal residents in the UK are covered. 10.5% of its populace also have opted for private coverage to gain more rapid services to elective care and other subspecialty care. They have done this because primary care waits in the UK can be more than 1 month long. The primary care providers, or what they call general practitioners, GPs, are the gatekeepers to secondary specialty care. They have to have a referral from the GP to gain access. Patients are required to register with their local GP of choice. However, there is a shortage currently and many practices are full. Data in 2017 show there are on average 1,400 patients per GP, with 11% of practices as a solo practice. Nearly 60% of all GPs are self-employed. To help this issue have access, some areas have started to offer walk-in primary care clinics. If you're not a long-term resident in the UK, your access is limited to emergency room visits, but you must pay an out-of-pocket 150% of the NHS rate for service. Thus, many visitors and short-term residents in the UK carry travel medical insurance. If you're in England for a short visit, meaning less than 3 months, you may see a GP and qualify for temporary registration in the system, but must wait in those long lines for registration, like the rest of the population. Some visitors that are exempt from having to pay for healthcare services include short-term UK government employees, refugees, and NATO personnel. Even though it is a universal access system, the NHS does have out-of-pocket costs and copays. As a result, they have put in place some safety nets so that medical costs don't prohibit access. Out-of-pocket expenditures account for 15% of household healthcare spending in the UK. About 33% of this is on pharmaceutical products. Thus, the NHS has put in place cost control. For example, the average cost of a prescription in the UK is £880, which is about $12.50. 89% of the prescriptions in 2016, however, were dispensed for free. Other services like dental, which is 12% of household expenditures, or vision, about 20% of household expenditures, are also subject to copays. However, for students, the elderly, pregnant or recently pregnant, and patients with long-term conditions or disabilities, they are exempt. Even though we see a theme of considering the vulnerable, there are disparities and equities in the system. Age, gender, disabilities, income levels, and where you live continue to contribute to poor health outcomes. On average, those with low income levels have more diagnosed illness and live with those illnesses 10 years longer than their affluent counterparts. In particular, we see more of these inequities play out among ethnic groups. Those from Pakistani, Bangladesh, and Black Caribbean backgrounds are found to have higher levels of long-term illness as compared to their white population. Black women are 4 times more likely to die of pregnancy. Black minorities are 2 times more likely to die from COVID infection and 2 to 4 times more likely to develop diabetes. Finally, Black men are 3 times more likely to develop prostate cancer compared to their white counterparts. To address the disparities, the NHS has taken a systems approach. Public Health England is tasked to reduce health inequities and has published extensive guidance for local authorities. That's because budgets for public health are held by local government authorities, and thus much of the work is targeted there. The National Health Services strategies include ensuring local CCGs have adequate resources, measuring progress, financially incentivizing reductions in inequities to prioritize areas like mental health, sharing best practices when there is success, and using risk stratification tools to identify those that are at higher risk for illness. I will now turn it over to Alexa to discuss what innovations NHS will bring about to achieve this.
Thank you, Dana, for your portion of the presentation. Hi, my name is Alexa, and I'm here to talk about the beverage healthcare model, innovations and excellence. And we're going to start with the multiple steps by the NHS that are being taken to combat the challenge of a growing population, an aging population, and the national health debt. Integration and care coordination has been improved by the Vanguard system. Increased general practitioner care coordination is necessary due to aging population challenge. Integrated care systems promoted since 2012 by the NHS Health and Social Care Act and promoted by the NHS 5-year Forward View, published in 2014. Integrated care is defined as a closer link between hospital and community health services. Information shared between 50 Vanguard sites help combat this challenge. Vanguards are defined as smaller, collaborative working groups and are broken into 3 types: integrated primary and acute care systems, enhanced health and care homes, and multi-special community providers. 50 total Vanguards were chosen through a very selective and rigorous process. New care models for the future blueprints of the NHS system is up their goals for the Vanguards, and they were originally modeled after accountable care organizations in the United States. The General Practice Forward View, or the GP Forward View, was published in April 2016 with a £2.4 billion increase to general practitioner services annually to meet the increasing clinical demands of patient needs in the United Kingdom. The NHS Long-Term Plan, published in 2019, adds to this with 7 main chapters: The first is more options, better support, and right time for patients. The second, new actions funded by the NHS to increase contributions to health preventions and inequalities. The third, new priorities for the decade ahead. The fourth, support current staff and healthcare heroes. The fifth is to upgrade the supporting technology needed for healthcare. The sixth is to add a sustainable financial path for going forward. And the seventh are the steps into actually implementing the long-term plan. Now I'm going to hand off the presentation to Sabir.
Thank you, Alexa. My name is Sabartaj. I'll be talking about the healthcare equity as it relates to healthcare and climate change. Healthcare is one of the most carbon-intensive industries, producing 4.5% of all greenhouse emissions. The NHS could no longer ignore the devastating impact of climate change to the population it serves. Climate change contributes to respiratory, cardiovascular, infectious, and mental diseases, to name a few. NHS realized that not addressing climate change diminishes their core value, which is to provide high-quality care for all, now and for future generations. Thus, the Net Zero NHS Health and Care Act was introduced in 2022. The NHS became the first health system, and the UK became the first country to make the net zero carbon emissions commitment. The goal is that NHS partners and suppliers will be net zero by 2045. Accomplishments so far include world's first net zero delivery and surgery, zero emission ambulances, such as the one shown on this slide, response to climate change embedded in the strategy of every trust, and investment of over £550 million in energy efficiency and renewable energy projects. Predicted impact and futures of this act include addressing healthcare inequalities for the vulnerable and the marginalized, since this is the population that is primarily affected by climate change. It is also to reduce the burden of disease. It is estimated that greater than 140,000 lives per year will be saved from improved air pollution, increased physical activity, and healthier diets. Furthermore, digitizing the healthcare system and optimizing location of care will increase efficient use of healthcare. It will reduce travel and duplication of medical care. It will also enforce best clinical practice. Promoting factors include recognition of the problem and willingness to change by payers, providers, and insured. Of the 1.4 million providers in the UK, 1.26 million of them want to do something about climate change. Other promoting factors include cooperation from partners and suppliers, transparency and communication, as well as public participation, involvement, and engagement. Constraining factors include cost. With the Net Zero Act, 20% of upfront capital investment is estimated to be return on investment at 3.5 years. Long lead times are also a constraint, as you have to wait to raise capital, or you have to wait for new technology to come down the line to work on these projects. Lastly, the varied delivery of healthcare amongst the 220 trusts is also a constraining factor. Thank you for listening to our beverage model presentation. We welcome any comments and questions.